Why are more young adults getting cancer? The shocking rise explained. Something unusual is happening in cancer clinics around the world. Diseases once associated mainly with older adults are increasingly being diagnosed in people in their 20s, 30s, and 40s. A young person may feel healthy, stay physically active, and have no obvious family history of cancer. Then, persistent fatigue, unexplained bleeding, abdominal discomfort, or unusual weight loss leads to a diagnosis they never expected. Why are more young adults developing cancer? Is it modern food, obesity, pollution, stress, genetics, or something else entirely? The honest answer is that scientists do not yet have one complete explanation, but several important clues are beginning to emerge. Early onset cancer generally refers to cancer diagnosed before the age of 50. Researchers have reported concerning increases in several types, including colorectal, breast, kidney, pancreatic, uterine, and certain stomach cancers. This does not mean that most young adults will develop cancer. Cancer remains more common with increasing age. However, the changing pattern is significant enough that researchers are investigating what may have shifted across recent generations. One important clue is that people born in more recent decades appear to face different exposures throughout life than earlier generations did. From childhood onward, many people now experience highly processed diets, reduced physical activity, disrupted sleep, obesity, antibiotic exposure, air pollution, and contact with thousands of environmental chemicals. These factors may influence inflammation, hormones, metabolism, immunity, and the microorganisms living inside the digestive system. Cancer usually does not begin because of one single exposure. It develops when normal cells gradually accumulate changes that allow them to grow uncontrollably, avoid immune destruction, and eventually invade surrounding tissue. The process may take years. This means that exposures during childhood or adolescence could potentially influence cancer risk much later. Obesity and metabolic dysfunction are major areas of research. Excess body fat is not simply stored energy. Fat tissue can release hormones and inflammatory signals that affect cells throughout the body. High insulin levels and insulin-like growth signals may encourage certain cells to divide more frequently. The more often a cell divides, the more opportunities there are for DNA copying mistakes to occur. But body weight cannot explain everything. Many young cancer patients are not obese, which tells researchers that additional factors must be involved. Diet may be another piece of the puzzle. Diets high in processed meat, refined carbohydrates, and heavily processed foods are being studied for their possible effects on inflammation, metabolism, and colorectal cancer risk. At the same time, diets low in fiber may reduce the diversity of beneficial gut bacteria. These microorganisms help produce compounds that support the intestinal lining and regulate inflammation. When the gut microbiome becomes unbalanced, harmful bacteria and inflammatory molecules may become more influential. Researchers are investigating whether these changes could contribute to some early-onset colorectal cancers. However, no individual food or bacterial species has been proven to explain the entire trend. Alcohol and tobacco remain established cancer risks. Even moderate-looking patterns of repeated exposure can accumulate over many years. Vaping is newer, and scientists are still studying its long-term health effects. Environmental exposure is another growing research area. Air pollution, pesticides, industrial chemicals, and substances that interfere with hormones may affect cells in ways that are not always immediately visible. Proving that one chemical caused one person's cancer is extremely difficult. People encounter mixtures of exposures over decades, making the investigation far more complicated than studying a single substance in a laboratory. Researchers are also studying biological aging. Two people may both be 40 years old, yet their organs and cells may not be aging at the same rate. Chronic inflammation, metabolic stress, poor sleep, and environmental exposure may cause some tissues to show signs of accelerated biological aging. Scientists are investigating whether younger generations are experiencing certain age-related cellular changes earlier in life, potentially creating conditions in which cancer can develop sooner. Genetics still matters, especially when cancer occurs at a very young age or appears repeatedly within a family. Inherited mutations can substantially increase the risks of breast, ovarian, colorectal, pancreatic, and other cancers. But most early-onset cancer cases cannot currently be explained by a known inherited mutation. In many patients, cancer likely develops through a combination of genetic vulnerability and environmental or lifestyle influences. Another challenge is delayed diagnosis. Young adults and even healthcare professionals may initially assume that symptoms are caused by stress, hemorrhoids, digestive problems, or another harmless condition. This can allow some cancers to progress before testing begins. Symptoms such as unexplained bleeding, a lasting change in bowel habits, a persistent lump, unusual weight loss, worsening pain, severe fatigue, or a symptom that repeatedly returns should not automatically be dismissed because someone is young. Having one of these symptoms does not mean that a person has cancer. Most symptoms have non-cancerous explanations, but persistent or worsening changes deserve medical evaluation. Screening guidelines are also evolving. In several countries, routine colorectal cancer screening now begins earlier than it did in the past because of changing disease patterns. People with strong family histories, inherited syndromes, inflammatory bowel disease, or other major risk factors may need personalized screening that begins even earlier. There is currently no single test that can reliably screen every young adult for every cancer. That is why awareness, family history, appropriate screening, and timely evaluation remain so important. The rise in early-onset cancer is not proof that modern life is poisoning everyone, and it should not create panic. It is a complex medical signal that researchers are working urgently to understand. The most useful response is not fear, it is informed action. Avoid tobacco, limit alcohol, maintain regular physical activity, eat a fiber-rich diet, protect sleep, manage body weight when possible, and attend recommended screenings. Most importantly, learn what is normal for your body. When a meaningful change persists, seek medical advice rather than assuming that youth makes cancer impossible. Scientists may eventually discover that early-onset cancer is not one mystery, but several overlapping problems, each with different causes and prevention strategies. Until then, awareness remains powerful. Cancer in young adults is still uncommon, but it is real, and recognizing it earlier may save lives. Subscribe for more evidence-based cancer education, and share this video with someone who still believes cancer only affects older people.